Thank you for joining me on this chapter of our course. In this first video, we will be looking at the terminology and some core concepts that will help you as we dive into understanding better the human body. To set the scene, so to speak, during your time on this course, but also as you move ahead on other classes and eventually on your own profession, you will be exposed to some terms that might not initially, on layman's language, seem intuitive. This is the language of medicine. And although this is not the main message that I want to communicate during this video, I think it is important that you understand where some of the terms that you will be exposed to come from. First of all, a lot of the terms that we will see originate either from Greek or Latin. I was fortunate enough to have been directed to study Latin for many years during my secondary school, and never did I think at the time how useful it would be. After all, there is very few places where you can go and actually speak Latin. Only Vatican comes to mind. But in reality, it is either the entire medical terms or word parts that often originate from these languages. One good example would be the term arthritis. This means, of course, the inflammation of one or more joints. The term itself comes from Greek term arthron, which means a joint. But that is not the only source of terminology. I often call the language of medicine as the language of dead old men. Really, many terms are often derived from the name of a person. Say, a physician or scientist who was the first to identify the technique or condition. Alzheimer's disease would be a good example of that. As a side note, please note that it is not Alzheimer's, but Alzheimer. It seems that even clinicians often get confused about that. Another typical source for medical terms is all kinds of acronyms. It seems that we, on the medical field, love abbreviating things. So these would be the terms formed from the first letters of the words in a phrase. And often these become so common in use that we start to associate them as a whole word. For example, laser stands for light amplification by stimulating emission of radiation. How about that? Finally, a lot of folks like me, who are not native English speakers, will know that many modern terms in medicine are derived from English. As an example, I spent many years of my professional life in the medical imaging field, in particular developing MRI scanners. Of course, this term comes from the terms magnetic resonance imaging. But did you know that it was not what we called this technique initially? Rather, we talked about nuclear imaging techniques, which is in terms of the physics involved much more accurate. But the public perception to a word nuclear is hardly going to attract people to line up to get a medical scan. So we have compromised. There is also a lot of other abbreviations and acronyms that we tend to use. For example, when writing patient records. Some of these will become more familiar to you as we progress on your studies, but this is for now just to show you that it is really something that is common in the field. The next thing that I want to talk about with you is the terms anatomy and physiology themselves. What do they mean? Why do you need to know the difference? And their connection with each other? Well, anatomy refers to the study of structure. It is all about understanding the parts that make up a body part. Where these parts are located, what shape they are, what they are made of, and so on. So it can be considered to be all about the form. On the other hand, physiology is interested in how the body part acts or functions, if you wish. Now we are not so interested in what the parts' names are and so on, but we want to understand how they do the job of that body part. Well, here is a question for you. Can you study anatomy while not having to pay any attention to physiology? Well, the answer is kind of yes and no. I am actually an anatomist by trade. I spent nearly a decade in the university studying the structure of a human body, first as an undergrad and then doing 2 postgraduate degrees on pure anatomy. So yes, you can get a degree in anatomy alone. But really, to understand why certain parts of the body are structured in a way they are, you must have an appreciation of how these parts work together and what they aim to achieve. There is no anatomy without physiology, just as there is no form without function, and the other way around. Take for an example of this knee joint. It is very well that we understand the bones that make up it, femur, tibia, fibula, and of course patella. But they alone are barely going to explain us how is it going to work. And even if we add some soft tissues like muscles, tendons, and ligaments, if we look at those as stationary structures, we are still barely going to know how does it really work. In the field of anatomy alone, there is a lot of sub-areas. You can be like me and have your focus on gross anatomy, the big structures that are visible with a naked eye. Or you might be very interested in the fine structure of, say, bone matrix. This would be microanatomy. Or if that rocks your boat, you can be interested in the evolutionary anatomy. That is how the knee of a modern human developed over many generations and how does it differ from those of our ancestors. Or how about a developing baby in the mother's uterus? What parts of the knee come about first, and how many weeks of development? If you would be interested in these questions, you would be studying embryonic anatomy. There is a lot of other examples that we could use, but I think that you get the idea. But to understanding all these parts alone is hardly going to be useful for us in a clinical practice, for an example. Of course, we would be interested in how do these structures actually work together. What sort of movements are possible? How efficient they are? How much stress can different activities put on the knee joint? And many other questions like that. One might be interested about aging anatomy. What happens to older folks' ability in regards to their knee functioning? That would be geriatric physiology. Or you might be interested in sports physiology, how athletes' knee functions. Can we test the range of movement to predict who has the best odds of succeeding as a professional football player, and so on. So again, many subfields that we can go into. And then, of course, for those of you who want to go into clinical practice, how about sick or injured knee? Well, this would be all about pathology. The field of pathology studies diseases. But to be able to understand what happens when things go wrong, we must first understand the form and function of that body part in a healthy individual. This slide here I have included just to remind you that there are different levels of organization that we can study. This should be all familiar to you from your introductory biology classes, BIO201 or BIO201. And I will not be going through it in more detail. If you feel that you have forgotten this, please revise from your textbook and previous notes from earlier courses. I can even put a link to my online BIO256 class video if you feel that you need it. Just look for a link at the end of this video. There are certain things that we need to be able to do to classify as being alive. This again should be familiar to you from your previous studies, in particular BIO156 or BIO181. I will again provide a link to a video lecture from those classes at the end of this lecture. But please make sure to revise these concepts if you have forgotten them. The final concept that we need to revise is the homeostasis. This refers to the physiological processes involved in maintaining a consistent internal environment. The diagram that your textbook offers is frankly a little busy, so I have a better explanation about it available next. All I want to highlight from this picture is that it is kind of a seesaw in a sense. The body tries to maintain us in a happy medium, in the middle, without swinging too far either direction. So, I will see you at the next section of this week's module. I look forward to you joining me for it. See you soon!